It's a really exciting time right now for treatment options because there are a few new medications that are specific to PPD that came out in 2019 and 2023. Historically, for PPD, we have seen SSRIs and SNRIs used for postpartum depression. But SSRIs and SNRIs are actually general antidepressants, and they're not specific for PPD. GABA-A module was approved by the FDA in 2019. A module is a medication that works in the brain, essentially to regulate and adjust mood, and it's specific for postpartum depression. GABA-A modulator is administered via an injection, and it lasts for 2.5 days. So that means the patient will stay overnight in the hospital to be monitored for those 2.5 days. So in 2023, the neuroactive steroid version of the GABA-A modulator was approved by the FDA. And it's similar to the other medication in terms of how it works in your brain and the fact that it's specific to PPD. Major difference is that it's taken orally for 14 days rather than doing an infusion in the hospital. And that's major looking ahead for PPD treatment. If you think about access and even an intimidation factor of having to go into the hospital for 2.5 days, this increases access, makes it a bit more approachable in terms of options for PPD. Historically, with medications in the past, we've seen a much longer course of treatment. So 14 days might sound like a long time if you're struggling, but in the grand scheme of things, it's actually quite quick. And the fact also that it is an oral medication rather than one that you have to go into the hospital and have an infusion for can feel a lot more approachable and accessible.